Say hi. Everybody needs their spaniel fix. All right. Hey, with the itchies. All right. Good morning. Yesterday was a busy day. Hugh went to the farm at 6 o'clock in the morning. They started pouring concrete, and they finished about 6:30 last night. Lots and lots and lots of concrete. Our house isn't huge, but it's got a oversized 3-car garage for storage because there's no basement, no attic, and a huge patio because for us, outdoor living is why we moved south. And we're going to do a lot of outdoor living, and now the patio is poured, and that means as soon as it stops pouring rain, I can set up my chair on the patio and oversee the land. I'm excited. But I was really busy. I'm working on a new project, so that occupied, the empty spaces of the day yesterday, which there were none, and did a whole bunch of consultations. But one of them was for a client who I just adore. She has 2 boxers up in Pennsylvania, and she had been coming to my clinics with her 2 dogs for quite a number of years. It started out with her male boxer, who's intact, had prostatitis, so an enlarged prostate, and he would occasionally bleed from his penis. And so she came to me because she didn't want to have him neutered, and she wanted to know what we could do. And we have been treating him with herbs, and he's done incredibly well, until about June or July. She brought him in and said, hey, can you check his tongue? He's a wood personality, so that's a little tricky. But she said, and this was during curbside. So, but I have to say, he actually was better without her because I think he was very protective of her, which is what he's supposed to. You can just mail that in, honey. That's what the envelopes were. So he did actually let me look at his tongue, and she thought that he had bitten his tongue because he literally had a hole through his tongue. And when I looked at it, and it supposedly had just happened within the last day or so. And when I looked at it, there was dead tissue in that hole in the tongue. And I said, oh, that's not where he bit his tongue. That's dead tissue. Something else is going on here. And she wanted to have him have a dental. And because he's a boxer and, concerns, I said, well, why don't, and she wanted a couple of masses looked at because he's had mast cell tumors in the past. So she was going to take him to a specialty center to put him under and have a dental. Well, when she took him to the specialty center and they put him under, they biopsied the tongue, and it ended up being lymphoma in the tongue, which is very rare to say the least. Never heard of it. Can't even find articles on it. And so he started chemo because what are you going to do when you can't remove his whole tongue? So started chemo, and he did really well. And then she had to switch oncologists, and the second oncologist didn't like what the first one had done. It's shocking. Wanted to change protocols because he wasn't doing as well as they would have liked him to. And he was also on high doses of prednisone. That's almost always part of the lymphoma protocol. And unfortunately, he ulcerated his stomach from the high doses of steroids and all the chemo and everything else, and almost bled to death. Had to have transfusions, stopped the prednisone, start him on some sucralfate to protect his stomach. And he did get through all that, which is really good. The biggest problem was that when they stopped the prednisone, the lymphoma went crazy, and he started popping up lymphoma nodules under his skin, on his foot, on his abdomen, on his chest. And this is kind of what we saw with Myra. She was on high doses of steroids, and when we tried to drop them back, because she was really having side effects because of the high doses, the lymphoma will break through. And I saw this a lot in practice with lymphoma patients. We don't want to keep them on the high doses of steroids, so we always try to reduce them. And generally, when we start the steroids on these lymphoma dogs, if they have big lymph nodes, the nodes will go down right away. The dogs feel better. They look great. Everybody gets so happy. But when 9 times out of 10, when you start to decrease the prednisone, or if you have to stop the prednisone, the lymphoma then becomes very resistant, and it'll reemerge with a vengeance. And that's what happened with his, and it's popping up everywhere now. And so they started, she was given options of 4 different chemo drugs they could use. One of them is very toxic to the heart. So she said, well, he's a boxer, we're not going to do that. And so they opted for a fairly new chemo drug that the statistics that the clinician gave her were, well, 9 dogs have had this drug used in them. Oh, Lordy, we're using a drug that's been used in 9 dogs, and like 20% of them did well, 40% of them had some improvement, and the rest of them had, no response to it or had bad side effects. So really scary when you get into, that level of chemo with these resistant lymphomas. And when they become that resistant, it's very difficult. So what started out as sort of a 30-minute follow-up, she had just been to the oncologist that morning. So what started out as, hey, we'll just do a quick touch-up on diet and herbs and supplements, turned into an hour and a half of both of us crying and talking about hospice care and end of life and that sort of thing. And so it's a difficult conversation. But, at some point, you realize that things are not going in the dog's favor. So we'll see how he responds to the new drug. Hopefully he won't have too many side effects. The biggest side effect is they stop eating and they get really nauseous. And I hope that doesn't happen, because it's the one thing he has going for him right now. He loves to eat and he's doing really well. And when you have a pet with cancer, nutrition is the most important thing. If they don't have calories going in, the good news is, even with his tongue as bad as it is, he can't work it very well, but he can still drink. So he is getting fluids, and she's devised a way using a spoon and a spatula to get his food far enough back in his mouth for him to be able to eat. So, it's amazing the things that we will do for these old kids to make sure that they're getting what they need and getting their nutrition in. She's just kind of in a tough spot right now. So, just for those of you with animals that are suffering with lymphoma, lymphoma is actually one of those cancers that veterinarians have a pretty good handle on. And there are a lot of dogs that do go into remission for very long periods of time. It's kind of when they pop back out of remission that it's a problem. His cancer is just such an unusual cancer that knowing how to deal with it is pretty hard, because there's not a lot of studies that you can look at. There's not a lot of literature to look at. And my project that I'm working on, I'm reading all kinds of research studies. They're hard to read. It's not fun. It's not fun. I think I need to import Teresa Carpenter for a while, because she's got that metal personality and she can sift through these reports for me and would do a great job at them. And she'd probably make me great spreadsheets on this, that, and the other thing. It would be awesome. I wouldn't understand any of them, but she could explain it. So, so everybody, Windsor the boxer, he's actually a cool dude. Okay, everybody, have a wonderful day.